One of the greatest experiences in a parent's life is the day their child is born, but it's not always the perfect outcome. 23 News reporter Joe Hamilton joins us to share his story of what happened to his 5-month-old son Chase and the medical breakthroughs trying to help him. Joe?
Well, Laura, last week my son underwent nerve reconstruction surgery on his shoulder to try and repair several nerves that were severed during birth. There aren't any facilities in the state that perform the surgery my son needs, so we went to Texas. And now there is hope that my son will be able to use his arm again. My wife Lisa and I are hoping that surgeons can help restore movement to our son Chase's left arm that was paralyzed during his birth 5 months ago. We've brought him to Texas Children's Hospital in Houston, one of the leading hospitals in the world treating children with brachial plexus injuries. This complex network of nerves runs along the shoulder that transmits signals from the spine. When these nerves are injured and stretched, they can tear and lead to paralysis of the arm, as what happened to my son Chase. This injury is usually caused by stretching the neck during a traumatic delivery. Doctors will now try and repair the damage. This was one of the most difficult things my wife and I have ever had to do. But we're optimistic, even after learning how severe the injury is.
7 and 8 are completely pulled off the spinal cord. You cannot reattach them to the spinal cord. Okay?
Exactly.
6, when we try to transmit through the neuroma, okay, we get blockage of 6, which means 6 is broken inside.
So there are two types of grafts that doctors can do. They can cut out the scar or the neuroma entirely between these two nerve branches out here. Then they can put a graft across them like this. Or they can leave the neuroma and go around it by using jumper cable grafts, something similar to this.
Okay.
We're about halfway through.
Okay.
Okay?
So obviously this is one of the more severe injuries that you guys have seen?
It's very severe.
Surgeons spent more than 4 hours reconstructing and transferring nerves from our son's neck and grafting them to his shoulder. Doctors now hope that one nerve will work what 4 were intended to. When Chase was brought to recovery, his little body was swollen and scarred from the procedure. It had an effect my wife and I were not prepared for. But doctors do believe that the surgery went well.
You know, everything is injured on this guy. Anyway, that wouldn't have got better on its own, so I'm glad we got the surgery done right at the right time. And he did fine with it. He's a real strong child.
A tough little boy who's had to endure a lot of pain so that one day he may be able to reach out to us with his other arm. Now doctors are giving Chase a better than 60% chance that he will be able to do that, but it could be 6 months or more before we see any results. Now I did this story because I know other parents whose children have suffered the same injury, and they didn't know what to do or where to turn. So I wanted to show parents that there are doctors who are giving children with this rare injury a chance for normal life.
What a lot you've been through. I know we were all wondering where you were and how things were going, and this surgery just seems quite extensive that you underwent, and poor Chase.
Well, we're not done yet. They have to do some muscle reconstruction as well in a couple of months, but the reason it takes so long because they don't actually graft it, take a nerve away. They actually, it's kind of like a sausage casing. I guess the best way to do it, they take a casing from a good nerve from his neck, and then they attach it to the good nerve to the bad nerve, and that actually, the nerve has to grow through like a conduit. It takes about 6 months or so, 6 months basically to 5 years to find out if it works or not. So we're hoping,
So this is just the beginning step of a long process, but hopefully one that will turn out for the best.
It is. In about 6 months, we should be able to see a little bit of movement in his arm. Is what we're hoping.
Well, we're keeping our fingers crossed for you. And for Chase, best of luck to you.
Well,
thank you for sharing that story with us.
No problem.
Absolutely amazing story there. And we're going to turn to some amazing weather, going from some serious stuff to some good times, hopefully in the weather department ahead. Let's go to meteorologist Mark Henderson. Mark?
Yeah, absolutely. We do have some very pleasant weather in the forecast.